let's say someone's a med student, they're in their, third year doing rotations. They think they
Mhm.
may want to do vascular surgery. What would be your advice to them, like as far as like how they can get enough exposure, find out if they
Mhm.
really like it, and then things they can do to like help their application and with applying?
Yeah, so academic vascular surgery is very small. There's only about, I think, 50 or 60 programs in the country for a total of maybe 70 or 80 spots. So that just means that it's competitive, but it's competitive in the sense that they really, what they're looking for are students and eventually residents who are really dedicated to the specialty. They're not looking for someone who wants to do, oh, this is a surgical specialty, it's 5 years, I'll be done, and then I can like be a surgeon. I think the most important thing in vascular surgery is interest in vascular surgery and commitment to vascular surgery. And the ways you can show that are either by research or doing really well on your away rotations. So I always recommend, I know it's difficult with COVID, but I always recommend away rotations for medical students. One, because you can see what a different institution is like from yours. And two, if you are smart enough about which institutions you pick and you do a good job, you can get a very, very strong letter from, let's say, the chair or the program director. And it's very likely that that chair or program director knows almost every other chair and every other program director in the country. So that letter will carry a lot of weight. So in kind of the same way that you want to do on your away rotations, I also recommend students attend conferences. You'll see by like your second or third conference, you'll see the same people again and again. And the vascular annual meeting is our biggest conference. There's like a residency fair where I went between my third and fourth year, and I got two of my away rotations just by attending that conference and being like, hey, I'm interested in vascular surgery. Like, I'd love to do an away rotation with you guys. And they just made it happen. So really it's about interest. Obviously, step scores are important. Publications will help you. But if you just kind of get FaceTime with people and you show that you're interested and your CV shows like, good letters and stuff like that, that will take you very, very far.
That's awesome. So I'm curious for these away rotations, like how many do people typically do? And this obviously may have changed, like you said, with COVID, but
Yeah.
what would be like the typical amount people would do? And I guess what's, especially now that you're kind of on the other side of it, what's your advice for people kind of standing out and doing the best job they can on one of those?
I think most people average about two because that's about the time they can fit in before letters and things are have to be submitted for ERAS. I did three myself and I thought that was too much. So I think two is probably the sweet spot because by the third one, you start to get tired and burnt out unless you can like fit a break in between them. Having had a bunch of sub-Is now, you can see the ones that like really want to be here and really want to learn about the program versus the ones who kind of are just here because they think that's the right thing that they should do. And what we are always looking for me at least, and I think a lot of my co-residents will agree, we're looking for students who can anticipate what we want to do next and what's going to happen next, whether it's in the OR, whether it's, taking down a dressing ahead of time on rounds, whether it's being prepared with the list. Students who can anticipate tell us that they're students who are paying attention. If we're in the OR and we're getting a patient ready for an angiogram and it's our like fourth angiogram of the day and you don't know by now that we tuck the arms and shave the groins before we start, it just tells me that you're not really paying attention. I think most people would take any student who is attentive and listening and has a positive and upbeat attitude over a student who already knows all of the disease pathology and knows all the answers and steps to an operation. Like, I think being easy to work with is a really big part of being a good sub-I. And it's hard to really define it, but basically you, as a student, you want to be available, but not so available that you're like getting in the way. You don't want to be like obstructive because at the end of the day, if you can make things move along and you can make your residents look good and help out the patients, that reflects really highly of you. And so I think having a good upbeat attitude will take you very, very far because we don't expect students coming from another institution to know what we like. But we do expect, or at least the good ones, that once you've seen it a couple of times, you can kind of anticipate and kind of learn what it is that we do here. And, and then the basics of like, I feel like every student should do no matter what, just like know what case you're going into, know the indications of the case, talk to the patient beforehand. Those are kind of all standard things that everyone should be doing.
Awesome. I'm obviously haven't been doing it as long as you have, but I've worked with some sub-Is and I think I could echo a lot what you said, that it's, this, it's honestly the simple things like paying, like you said, paying attention, showing up, being punctual, knowing
Mhm.
your place. I think, I'm sure you've had this experience. It's kind of shocking what some medical students will do being on the other side of that. I mean, you see a wide array. You see students obviously that are very, very good and do
Yeah.
everything that you mentioned, but then you see some that they'll be there in a way rotation and they're like not interested in being there, or like they'll say, oh, I only do the big cases, I don't like or stuff like that. And
Yeah.
that's just like, that just doesn't look good.
Yeah, I mean, I feel like if as a student you're telling me that you think this case is beneath you, then you're only going to get worse as a resident. Like, so we're trying to see if you're going to be like a hard worker and fit in well with our program. So yeah, I totally agree with everything you said. You definitely see a wide array, and you can tell almost within the first week of working with somebody whether or not they're going to be good.
Awesome.
It's just, I feel like it's like about personality, right? It's about like how hard they want to work, if they have a good attitude, and if they like actually really want to be here.
Yeah, no, I think that makes a huge difference because, these programs are small, like you said, like vascular surgery, you guys only have a couple slots per year. IR is the same way.
Yeah.
Ours is on the bigger side. We have 4 per year, but and then we
Wow.
have and then we have some ESIR slots as well. But a lot of programs are like 1 or 2 slots per year. So these are people you have to work, like you're essentially like, they're going to have to work with you again. Like when I think of these people, especially even being a junior resident, I think of people like these are going to be my junior residents if they come
Yeah.
here. And like,
Right.
I don't want someone who's like entitled or not going to, put the effort in.
Right. Or someone that I feel like I can't teach or won't listen.
Right. Yeah. Very, very true. Very true. Um, so I guess kind of the last part here, so someone's made that final commitment, they've done their ways, they've applied. I guess I realize we could do a whole podcast on this, but like, what's your kind of advice with, the application process, interviewing, those types of
Yeah.
things for vascular surgery residency?
For the application process, I would say apply to every program just because there's only so many programs. You want to have a shot everywhere. Obviously, don't apply if you know 100% you're not going to go. But I think there's only so many spots in the program. I think everyone should apply to everywhere. And then secondly, this may seem like common sense, but maybe it's not. If you're dual applying to general surgery, which a lot of students do not dual apply general surgery and vascular surgery at the same institution because the programs will talk and they will somehow figure it out. And it just doesn't really look good because inevitably one of the departments will say, well, I'm just a backup for the other department. And it's just not going to do well for you. And then this is going to be kind of cheesy, but have a lot of fun on interviews. Some of my really good friends came from the interview season because you see the same like 60, 70 people the whole time. And kind of it's different now with like virtual interviews and stuff like that, which is unfortunate, but these are going to be your colleagues for the rest of your life. And some of them will be department chairs, some of them will be program directors, some of them will be in private practice. Other people you'll be like doing publications with, get to know them because you're probably going to know them for the rest of your life. And you'll see the same people, like the really strong applicants, the ones who have done the aways, who have gotten the letters, who have done the research. You'll see them again and again on your interviews. And, it's really not that cutthroat in vascular surgery. And you can kind of tell like by the end who wants to go where and where they're going to end up. And so I think it's just like stay friendly with people, stay on good terms with people. These are people you're going to be working with for the rest of your life. And I really didn't realize that until the end of the interview season when I was like, I think I've seen this person like 10 times on the interview trail. And then like next year I attended a conference and they were there. And then I saw them again this past year. It's a really small field. So I think, staying on good terms with everybody. And I don't want to say playing nice because it's not cutthroat, but realizing that you're all working towards the same end goal and you could form like really good friendships out of this too.
That's awesome. I think that's really good advice, and building those relationships. And I'll
Mhm.
echo that. You see people. I remember seeing people a lot on the interview trail in many places, and then it's cool. You see them again at conferences, and you're like,
Right,
oh, hey, I interviewed with. Maybe they're not at your program, but you're like, hey, I interviewed with you at this
right,
place, or what'd you think of
right,
that? And
right.
you kind of have this shared bond that
Mhm.
continues to grow. That's awesome.
And even across specialties. I mean, like when you and I were talking about the people that we already know mutually, I was like, who's the person at Emory? And you're like, oh, who's that MedStar? It's like, it's nice to know everybody and like, kind of have that relationship.